glad to be here, and Jim's again too kind. But yesterday I was talking to Peter, and he was saying that there were too many 90s references in these presentations, and I went back to my hotel and I said, hold my beer. So I apologize for that in advance. So today I'm going to be talking about kinship networks and health and some kind of new modeling applications that I think offer kind of additional ways to think about kinship networks as influencing our health or as topics of inquiry in and of themselves beyond what Jim just presented. So first I'm going to kind of talk through social networks and health as a field and sort of what network is being conceptualized within that and really make the case for the importance of family and kinship networks in that. Then I'm going to kind of elucidate what I view as my framework for kind of thinking about how family and kinship networks might fit in a social networks and health kind of worldview, kind of building on some of the stuff Jim was just talking about. And then last, I'm going to kind of end with kind of various resources that exist for doing kinship network and health research that you could apply for your own work. And for those who are interested in the 1990s, you'll recognize the program as being the Festivus kind of set of events. So the first part is going to be really an airing of grievances. The second part will kind of be a feats of strength, kind of trying to feature and showcase some of the work that I've done that I'm really proud of. And then the last part will kind of be discussing the Festivus miracle that has come about in the last couple of years. So we're going to start with airing of grievances. One time I submitted a paper to social networks and, no, just kidding. So social networks and health research overwhelmingly concentrates on these kind of friendship, peer, and acquaintance ties. I think that that is what most people think of when they think of social network analysis, when they think of all sorts of kind of networks. Those are what come to mind, and that is what most of the kind of analytic tools and things like that are geared around. Most of the ergo models, all that stuff, are focused on these kind of ties that are changeable and kind of relation network collection that we can get through name generators and things like that. There's a lot less attention to family and kinship ties. If you look at the Web of Science, you'll see 75,000 or so articles on social networks, but only about 8 to 10% of them have kind of family or kinship mentioned in that kind of analysis in the title abstract keywords. The same thing with the journal social networks. Early on, it started with almost no family, kinship, et cetera networks. It kind of ramped up in the 90s, and it sort of settled in around 10% or so of the papers published in this field kind of explicitly talk about kinship and family networks. However, even though they don't talk about them, they have family and kinship networks embedded in them. And I think it's not hard for us to realize that family and kinship networks are a central part of our social networks. And so Craig earlier pointed out the Fowler and Christakis work. And I feel like one of the most underappreciated components of that work is how central family and kinship networks were in creating that. This was a found social network based on what people in the Framingham Heart Study said, oh, you could contact this person if you lose contact with me. And that was how they kind of constructed this network between all the people. And in that network, it's about 55% of the ties are classified as kin ties. So it's a primarily kin-based network. Similarly, if you look at Lynn's work and Miller McPherson's work on social isolation in America and these discussions of growing or shrinking kind of social networks that we've seen over time, and if you look earlier at the Marsden paper as well, you'll see that the majority of people that we nominate as people who we talk to about important matters, those are family and kinship ties. And even like classic kind of network kind of research, things that we might think that you'd access our weak ties for, like the Search for Abortionist paper. If you go back and look at that, 50% of the people that they asked first for help were family and kinship network members. And even in the non-health literature, like we could think Mark Granovetter stuff on weak ties. These are canonical examples of non kind of kin ties, we would think. But if you look at the book that he has, which the Strength of Weak Ties paper was based on, he enumerated like who people turned to when they were seeking a job. And most of those were family, not most, but a non-trivial proportion were family and kinship-based ties as well. And family and kinship ties are not just important like overall, they are particularly important for certain developmental stages. And a lot of my research focuses on sort of the older adult developmental stage, which I think is a period of time where family and kinship ties primarily really come to shine as central components of our networks. And so this is looking at the General Social Survey 85, 2004, and 2010 kind of important matters nominations and the proportion of ties that are kin or non-kin by age. And you can see, above age 50, the majority of these kind of ties that people are nominating are these kin-based ties. Similarly, if you look at the time spent that people spend with different types of relations, most of our time spent with people in our network after the age of 50 or so is with these kind of close family ties, consistent with some of the theoretical models that were elaborated the other day. So what do we know about these ties? And this is where I think some of the network tools are kind of underdeveloped and need to kind of be reimagined and revitalized. So there is a really strong, as Jim pointed out, classic structural anthropology, kind of structural networks, anthropological networks literature that examines these ties. And it has great utility, kind of genealogical methods. Levi-Strauss and others have done things to look at kind of matrimonial exchange patterns where some clans are marrying their daughters off to the sons of other clans within a community, and that creates kind of the social structure overall. There's a kind of classic set of work by Doug White, the late Doug White, and others, kind of reimagining network graph statistics to not just think of kinships like this, where there's a parent who has two kids, but actually to flip the network around and think of it as a P-graph, where really the person themselves is connecting two nodes, and the nodes are different types of relations. This sort of builds on some of the ideas that Jim was talking about previously. There's different representations of those. And all of this literature is very strong and really interesting, but it's easy to get lost in. And I think in some ways for the social networks and health component, it is a little bit challenging to apply, although Jim just offered some really great examples of ways to think of it as applicable to kind of contemporary issues. So that was my airing of grievances. Now we're going to turn to the kind of feats of strength and thinking about how, some of these kind of different approaches to kinship network modeling might be able to shed light on health kind of aspects in the contemporary era. So when I think of a framework for social networks, broadly defined, I kind of draw inspiration from Jim's kind of way of thinking about this, that you have both an architecture perspective, or how the ties are organized and who's connected to whom, and a diffusion perspective, or what is flowing through the pipes, like health behaviors, stigma, something like that. And then you have sort of a macro scale kind of thing, how structures are created that are beyond just the dyadic level, and then a sort of more dyadic scale, what I call the relational kind of area. And I think that while there's huge value in the structural anthropology and kinship literature, I think that we could think about where that fits in this perspective and think about social networks and health as a way to enumerate with kinship networks, think about where we could build on that and come up with new ideas. So here's my attempt at that. I think a lot of the structural anthropology work really fits in this kind of upper structural and architecture-based kind of idea. And so the structural anthropology work really is thinking about how systems are organized, how matrimonial circuits exist, and things like that. So very much architecture-related stuff and often kind of macro-level kind of structure. But there's a lot of opportunity to think about the architecture kind of dimension at a more relational level. And here I think there are a lot of interesting questions that literature has not answered about person-level kin availability or kind of access to kin-based resources, like do you have educated people in your network that you could go to learn about college opportunities or access social support from them or things like that. There's also the whole diffusional side of this, which I think is underdeveloped as well. And the diffusional side of this could be thought of at the macro structural level, which might be like societal caregiving pressures that certain countries maybe are facing kind of crisis of care possibilities that are going to exacerbate social security demands and things like that. We could also think of it more at the relational level on the diffusion side of like what could be transmitted through kinship ties directly. And so like that could be interpersonal caregiving related things, or some of my stuff thinking about bereavement as a transmission through these networks, that the death of someone in that network is influencing other people's health outcomes. And so there are a number of kind of different methods for these approaches. You'll see like surveys appear in all of them, and qualitative stuff I tried to put where I thought it would fit in, to particularly elaborate ways of thinking about this. I think most people are familiar with kind of survey or experimental kind of approaches to some extent. But there are some areas that I think demographic methods offer particular ability to help us understand these contributions, and I tried to elaborate them here. So I think demographic microsimulation work and other things that I'm going to talk about really fit in for helping thinking about some of these other areas. So that's what I wanted to introduce to you as kind of topics through a couple of case studies and then showcase some resources that exist for analyzing data with that. So that would be microsimulation and the formal demography of kinship kind of approaches. Before I get to that, I'm going to just mention that there are some questions that we can answer with surveys about kinship networks overall. One that came up recently in the COVID period was, I had a couple papers that I'll talk about subsequently about bereavement from COVID, losing a loved one to COVID, and the number one question that I got asked every time I presented it is it different than losing a loved one to other types of things? And so I tried to answer this with a kind of interesting, I view it as a difference in difference kind of quasi-experimental design where we can take people. There was a survey that was in the field, and it was in the field from November to June of 2019 to 2020, and there were people who lost their spouse in the pre-COVID period and people who lost their spouse to COVID during the COVID period, and we could sort of compare how much difference in that like 3-month in the people who were widows for 3 months, how much different their health was from these things. And so in the pre-COVID period, you see that the people who are not recently widowed versus the recently widowed, it's, you tend to be lonelier, you tend to be more depressed. There's a few other health outcomes that are very similar, but that during the COVID period, those who had lost their spouses to COVID-19 were substantially lonelier, substantially more depressed than you'd sort of expect basically if you extrapolated the pre-COVID kind of trend. And subsequently, we have a new paper that we're submitting soon that shows that it's not just the COVID period, it's actually losing a spouse to COVID, which I think sheds some light on kind of mechanisms of bereavement and suddenness and things like that, which I think is pretty exciting. I have another paper that tries to think through how we could kind of do interventions on kinship networks and think about ways to kind of operationalize our kinship networks and mobilize our kinship networks to improve our health outcomes. So this is with an R1 with my colleague JD Daw at Penn State, and we have we're looking at people who need kidney transplants. Kidney transplants, overwhelmingly 75% or so of them come from close family members when it's a living kidney donation. But people tend to ask the worst people that you could ask. They tend to ask their spouse. And your spouse you have no genetic match with, you tend to share health behaviors, you tend to share kind of health status with. They tend to be a bad person to ask. So we're trying to help people to think of a broader way to kind of enumerate their kinship networks and who they might ask in their kinship networks to see if that improves their kind of kidney transplant outcomes. And so we go through and we give people both ways to talk to family members about kinship networks, which is something that people report as a big challenge, like how do I initiate this conversation? So we give them kind of a conversation initiator. And we go through, we enumerate their networks, and we determine who might be the most likely kind of candidates. Because in qualitative work that we did previously, one of the reasons that a lot of people give up searching for a kidney is they ask 1 or 2 people, they tend not to match, and then they kind of give up. They find it hard conversation and they give up. So we tried to kind of come up with interventions that build around those kinship network processes in a way that maybe will improve outcomes. And we're about 6 months away from knowing the answer, which I'm excited about. So those are some ways to think about kind of survey-based or interventional kind of ways to think about kinship networks and health. But I think that there's a lot of other things that could be done with modeling approaches. And so one area that I think I would advocate that you pay attention to, because I think there's a lot of great opportunities with this, is demographic microsimulation for kinship network analysis, which can tell us things about sort of the structural network conditions that maybe underpin a societal change or underpin a society, and can tell us a little bit about what we might expect in the future. So demographic microsimulation as a model, you take in a bunch of rates, age, sex, race, other category-specific marriage, fertility, mortality, divorce, et cetera rates, and you put it into the microsimulation where people kind of interact with one another, and then it spits out like what the population structure is and how that might be changing, as well as like a complete census of all, like a life history census of all the relations in the society that are created through kind of birth, marriage, divorce, and things like that you can analyze and come up with kind of interesting, how many stepchildren do people have on average and things like that. Things that we can't enumerate with household surveys because they tend not to ask about living children that are outside of the household, for instance. And so the idea here is that you would have, a number of people at a kind of initial time point, and then they either get married to other people, some of them die, they give birth to others, and some of them move out of the community or whatever. You can model all sorts of processes like that, and then trace what the resulting kinship network that links that kind of society that you've created artificially looks like. So I'll give an example of how that application can help us think about social networks and health at the kind of macro scale kind of perspective. So we tend to think of most traditional societies, like traditional Chinese culture, we think of it as this huge extended family dominated kind of cultural phenomenon where people have these massive families of many, many cousins, many, many aunts and uncles and things like that. So I took kind of various Chinese data from 1700s up until 2100, and I fed it into a demographic microsimulation. I tested it against available survey data to show that it comes up with basically the same kind of structures that you would expect in terms of numbers of children, in terms of numbers of siblings in the data that I had available, and that really it matches kind of the demographic history of China. And what's cool about these data is it shows us something completely different than we would expect based on this kind of cultural notion of this massive extended families in historical periods. What it shows us is that contemporary China, not ancient China, has the most extended family kin networks. And this, I said I started in 1700, so this is not just like it took a little while to build up the numbers of cousins and aunts and uncles. Those should be built up in 50 years. This is a feature of the contemporary demographic transition. The fall in mortality is what creates the possibility for a massive boom in kinship in the contemporary era. And I think this upends a lot of traditional thoughts about traditional societies and things like that, but it also highlights a big potential challenge coming up in the near future, which is that the downslope of this is coming, it's coming quickly, and it's going to be quite brutal for a lot of societies. If you think through what that downslope might mean, you can begin to kind of come up with kind of macro level, structural, relational architecture kind of components for what this might impose on the society in terms of filial caregiving burdens and kind of kinship challenges that are created through need to care for people. So this is just the proportion from the 50s to 2050 of people in China who have at least one living parent, kind of middle-aged people with at least one living parent, suggesting that there's going to be and we're in the midst of a pretty big increase in kind of the percentage of the population that is going to be involved in kind of elder care kind of activities. And you can look at kind of different age groups, but you see the same pattern kind of unfolding slightly offset for each age group. And this is happening at the same time as there are substantial declines in siblings that you could share that burden with. Your parents are less likely to have siblings themselves that also sometimes help in these kind of kinship caregiving kind of situations. So it gives us an ability to kind of understand macro structural change that I think is kind of a unique opportunity. And it's not just China, like I don't want to just pick on China. This is a generalized feature of the demographic transition. This is based on villages in Thailand, but you could do the same thing with the United States or Switzerland or Ghana or whatever country. The demographic transition itself, the decline in mortality is what creates that burst of kind of kinship community structure. And then as fertility regularizes or declines to kind of lower levels, it then has a slope downwards. So this is a common feature that I think is broadly underappreciated. In the United States, I took the same kind of ideas and I applied it to thinking about, well, what kind of structure of family relations do older adults face in the United States going forward? And so one of the things that I was particularly interested in is the percentage of the older adult population that doesn't have children and doesn't have a spouse or a partner, as someone who might be able to provide care for them and think about kind of changes in the United States potential care needs. There's this very classic study by Redfoot and others, very highly kind of policy relevant, cited in presidential addresses and things like that, that thinks about the US kind of coming caregiving crisis as a product of just the ratio of 80-year-olds to 45-year-olds. And I think that what's cool about these models, these demographic microsimulation models, is they can allow us to answer that much more precisely. How many family caregivers are actually available? And if we were to merge it, which we are doing in a current paper that's under review, if we were to merge it with kind of disability needs or average patterns of care receipt, we can begin to understand the unfolding care crisis in a much more nuanced and accurate way than you would get just by looking at the cohort ratios of people that are 70 or 80 or whatever it is to the people who are 45. I also think that these models help us to begin to understand what I call like secondarily affected populations. And I think one of the projects that I'm the most proud of in recent years was thinking about the COVID-19 crisis as it unfolded. And I started out reading like these really dumb kind of tweets from Donald Trump and other people that were like, nobody dies of COVID. Of course, it's not a big deal. Nobody cares. These are only people that are really old and gonna die the next week. Nobody cares about them. And so I started kind of thinking like, is that really true? Like, what is the average age at which people die? Who do they know in the population? And it got me to thinking about this kind of idea of a secondarily affected population, or people who experience an event but don't die of it themselves through kind of kinship relations. And so in that kind of model, I took a demographic microsimulation, and on top of that, I simulated people dying of COVID-19 based on age, sex, and other patterns of COVID-19 death. And I asked, like, how many people are they leaving behind on average? And the answer that we found was about 9 individuals in total, and that this kind of breaks down into kind of different kin relations of who's being lost. So only a couple spouses are lost, but lots of people are leaving behind their grandchildren, which I think could help us to think, should we pay more attention to certain types of family loss as being particularly detrimental to people's health? So then I followed it up with a survey-based paper looking at the loss of grandparents and a couple survey papers looking at children's academic performance, graduating high school, and things like that. And I feel like this work was really impactful, and I was really lucky to kind of be a part of it with my colleague Emily Smith-Greenaway at USC. It kind of created all these like huge kind of cultural things that were really surprising to me. Like people made art on the basis of our project, which I was surprised by. And I think that it helps us to kind of contextualize disasters as being something that doesn't just kill those who, or doesn't just harm those who die themselves, but helps us to think about this broad kind of group of people that maybe are impacted beyond that. And I think social networks and health kind of research should pay more attention to thinking of ways that big events are being spread through networks and maybe have longer term kind of impacts on the population. Our estimates are that, for instance, over 10 million people in the US lost a close loved one to COVID-19. So this is a substantial kind of multiplier effect on the population, which could have huge population health ramifications. One of the things I was most proud of this is we were the first people to recognize that a ton of children were actually losing their parents to COVID-19. When we first noted it was about 40,000, but now it's over 200,000. And our work kind of led to kind of national narrative changes and efforts to get those children like hooked up with the Social Security that they would be eligible to from Social Security survivor benefits that a lot of them weren't getting, but that other research from economists and others show greatly improves outcomes from parental death and likelihood of graduating high school, not getting arrested, all that sort of stuff. So I was really proud of all that work. But there are a lot of downsides to microsimulation that I think, while I tout how great it is, I want to highlight that there are some challenges to it. So I'll go through the good parts of it. The good parts, it is one of the few tools, I think, that gives us the ability to look very long term at kind of social change beyond just 1 year or 6 months. It gives us the ability to look at social change over hundreds of years, and importantly, thinking about social change into the future, coming potential crises of caregiving, coming potential crises of bereavement or something like that. It also lets us look at kind of macro scale kind of phenomenon that a lot of our models are poorly situated to help us understand. And you can merge it with various agent-based models, or what we did with the microsimulation work with COVID-19 bereavement was thinking about like emergent kind of pandemics. We threw that on top of this and thought about what the kind of impacts of that might be. It also gives us an ability to get around some of what I call the empirical n=1 problem. When you think of a society level thing, it's often the case that there is only one United States population, right? But there could be slight variations on the United States population that maybe we're kind of unaware of. And so these simulation models help us to realize, like, are we in a sort of special case of the United States population? Or could the United States population very easily have been 50 million fewer and 50 million higher, or some kind of things like that, as well as the processes that generated us to the current point with immigration and things like that. The big downsides of the microsimulation world, though, are that it historically was very hard to implement in software. The original programs were all based in like C++, or I wrote a version in MATLAB, and with Katie Faust, I wrote one in SAS, IML at one point. And so there are a lot of kind of really difficult challenges to implementing this. But that has changed. It's not true anymore. I'll come back to that in the resources Festivus Miracle portion of the talk. But the data requirements are also really onerous for these kinds of things. You need hundreds of years of kind of rate-based data on like mortality, fertility, marriage, migration, some of which you end up having to make up. Like who knows what remarriage rates were like? Nobody measured that in 1920s China. So you sort of have to just take a guess and figure out, is it all right? It also kind of needs to be, because of those various guesses, you need to do some ground truthing, see if it matches empirical data. And so there's a lot of kind of iteration between running the model, testing whether it seems to work, making a tweak to the parameter, and things like that that are really challenging. And then, of course, you can't like readily compute this. The CDC is not going to put out numbers of people that are losing loved ones to COVID-19 because it's not addressable in that way. So which leads me to sort of the second set of models and a lot of my current work that I'm thinking about as a way to kind of think of advances in kinship networks and health kind of research and new kind of tools that we can use. So I like to go back to the kind of first paper on this, which was in the 1970s. People recognized that you could, through mathematical modeling, come up with expected distributions of kin under certain assumptions. If you know the age specific fertility rates and age-specific mortality rates, you can say, if that were to continue indefinitely, how many on average siblings would a 30-year-old have? How many on average parents would a 70-year-old have? And so you could have these kind of very simple kind of models that would tell us, for instance, a 40-year-old woman, if she lived through the 1965 United States demographic environment, how many cousins, older sisters, et cetera, she would have. This really kind of great set of tools that was developed in the 70s. And I always kind of highlight this because it's useful to remember that the current kind of slow publication crisis is not just a current phenomenon. It existed back in the day too. I don't know if Andy Abbott was in charge of theoretical population biology in the 70s, but and the challenge with this, though, these early models, was that they were focused on really, really simplified kind of ideas. Matrilineal only relations, only female kin, only female focal individuals. The rates can't change. You had to make an assumption that the population continued indefinitely at that rate. A lot of challenges like that that really made it divorced from any sort of reality that could be used, which is why these models, I don't think, were picked up at the level that they should have been. However, there's been a dam breaking on this kind of phenomenon recently and huge changes in what you could do with those types of models. So in particular, Hal Caswell has done brilliant work kind of extrapolating these models to think of all sorts of new phenomenon that you could examine. So he has two-sex models, so you can examine both women and men. Turns out there were some older approximations like double the number of parents, and that those yielded pretty good estimates in the end, but for certain types of things, actually two-sex models are particularly useful. There's also been work thinking about building in like exposure to people of certain types. So like Shisong and Hal have a nice set of papers thinking about exposure to unemployed individuals in your kinship network, which you can build into these models, and how those are changing over time. And then there's also some other ways of thinking about kind of changing rates and things to come up with much more realistic kind of population parameters that would tell us more realistic phenomena. And so I have a paper with Hal Caswell now that we're kind of trying to extend this to think about bereavement and think about cause of death contributions to bereavement. And so the innovation here is, instead of just modeling one type of mortality, we model as many as you want. You can stick it into this kind of block modeled mortality matrix, and then you create a block modeled fertility matrix, and you can come up with how many kin you're expected to lose by a certain age to, say, cancer versus heart disease versus suicide, et cetera. And so I have a couple applications of this, and my ultimate goal, I think, where I'm hoping to get, is that we could take these models, plug them just like life expectancy statistics, and think of them as bereavement expectancies. If you live to age 40, what is the probability that you lose a loved one to a car accident or to breast cancer or any sort of disease like that, which I think will help us as a society think not just about how many people are dying, but also who's affected by those kind of events, and think about maybe targeting kind of disease funding and things like that in kind of this kind of population impact that might be a little bit different than the targeting that we're doing with how many life years are lost and things of that nature. What's also nice about these measures is you can think about kind of what happens if we delete a cause. So what happens if we get rid of breast cancer? Would people then go on to live a long time and reduce bereavement substantially, or would it just kind of be absorbed and bereavement would be sort of similar because those people would die of something else the next year? Breast cancer is probably not one of those examples, but you can imagine Parkinson's or Alzheimer's maybe cutting people off at kind of the end of stage of life, and they probably would die relatively shorter periods after that, which can kind of answer sort of different ways of thinking about bereavement. So with these data, we can calculate these kind of bereavement expectancies. There's way too many diseases here, but the idea is we could do it by race, we could do it by sex. So this shows the probability of losing one of a parent, grandparent, child, or sibling to each of the 16 leading causes of death by race groups. And you can see as you age, your probability of experiencing these events goes up. But of course, the big killers, heart disease, malignant neoplasms, which is cancer, those are the ones that we're most likely to lose people from. We can also think about it in a kind of disparities framework. What are the disparities in losing loved ones to different causes of death experienced by different race groups, by different ages? So that here just graphs, the one on the left graphs, if you take the lowest probability of each of these and zero it out from the others, we can think of where the gaps in this experience are the widest in terms of age groups, what groups are disproportionately losing loved ones to certain diseases. And we can begin to think about the kind of social ramifications of some of these narratives around like deaths of despair and things like that. Who is losing loved ones? The New York Times is like cued into this idea ahead of us, but they have a way of thinking about it that is not like informed by an actual underlying model. It's just that people under 40 probably have parents that are still alive. So these people are, that it's not deaths of despair, it's people who are losing their children. And what we're able to do with our model is estimate actually how many people are losing children. What's the probability of losing your child to some of these deaths of despair causes, like suicide, liver disease, or drug overdose or accidents. And so these are kind of the rates of the crude suicide rates by race group. And I put them here to show that like those rates have gone up quite a bit for all the groups, but also that the next slide will show you those increases in levels and the group disparities are not translating directly into the bereavement levels. And so here are the bereavement levels for losing a child to suicide by age. So your probability, most people don't have kids before they're 20, and most people don't die of suicide at child ages. So we don't start seeing deaths of suicide, losing children to suicide until you're kind of in your 30s or 40s. But then you see this enormous unfolding disparity where Native American individuals are losing children to suicide at just staggering rates. And that those rates have gone up between 2003 and 2019, which are sort of the bookends of the available CDC data that I could harmonize. But that's not the story that we typically hear about this. It's not matching exactly what was happening with the death statistics. It's actually a little bit of a different story than we get. We can also look at the same idea by losing a sibling, for instance. And these numbers are pretty shockingly high. 37, 40 per thousand. Which is 4 or 5% kind of people experiencing the death of a sibling to some of these deaths of despair. And what's nice about the formal demographic models is we can actually model this sort of stuff for groups like Native American individuals that demographic microsimulation are poorly suited to examine because the demographic rates historically weren't like well tabulated for them, so we can't really model them, and they tend to be sort of smaller groups. So I'll kind of wrap up with what I see as sort of the Festivus miracle. These models were historically very difficult to implement, and I feel like I developed some expertise in them. And then the research literature has sort of provided the ability for other people to use these models very easily. There are two resources coming out of the Max Planck Institute for Demographic Research. One is this package called RSOCSIM, which is the demographic microsimulation package, and the other is our package called DemoKin, which allows you to compute these kind of matrix kinship models and some aspects of the bereavement stuff that are being implemented as we speak. So our SOCSIM package, this is the one for demographic microsimulation kind of modeling. You still have to get it through the DevTools kind of approach, and I wasn't able to come up with a good workbook, but I'm hopeful for 2024 that I'll have a good workbook tutorial. But if you can't wait for that, there's a great workshop listed below down here where they walk through kind of a toy analysis with United States rates, and you can run the models from that and kind of estimate kind of kinship models for the contemporary United States. Similarly, DemoKin, this is for the kind of formal demography of kinship kind of models, which currently has the two-sex model and things like that. Doesn't have the bereavement, cause-specific bereavement stuff that we recently developed, but that should be in there probably by the end of the summer. And that's a available R package that you can use right now. You could download it and use it. And the GitHub listed on the bottom there has a pretty good walkthrough of how to operationalize that and how to apply it for kind of various different rates to think about how demographic change maybe is influencing kind of these relational kind of networks. So I'm going to wrap up here because I know it's been a long day for a lot of people, but I think that I'll end with a kind of plea to the people who are thinking about social networks and health to also think about family and kinship networks as being vital components of our social networks and something that we can begin to model with some of the tools that I think are exciting, and to think about how this is impacting our health, both at the kind of societal level, but also at the relational or individual level. Family networks have kind of clear links to a lot of classic theories, as Jim's talk better articulated than I could. And I think what's nice is that they really do have these tools that are available to let you do this analysis yourself now. And I guess the last thing I'll say is that as society continues to age, as we have greater numbers of people over the age of 50, many more older adults, we're seeing a much larger proportion of the population enter into those age groups where family and kinship networks are the dominant forms of their relations. And therefore, I think this deserves extra attention when thinking about kind of population health issues related to that. So thank you very much.
So based on your projections you had talked about, at least in China, there's going to be a very steep, very difficult drop-off. Would you see something similar in the U.S. or other countries? And then how would you, I don't know if this is unfair, but how would you kind of extrapolate that to the mismatch problem that we have?
Yes, so you do see something similar in the United States. What our paper and review shows is that actually it is not as bad as the pure demography would kind of make you think, just thinking about the ratio kind of thing, because sort of disability rates, the way they're clustered in kind of family relations and things like that, it's just not as bad, basically. It's a really long answer, so I can send you the paper, but it is not as bad of a problem in the United States as you would guess based on the demography. In other countries, it does seem to be worse, actually, though. And I'll start repeating the question, sorry.
So back up with the COVID data, have you guys looked qualitatively at how the bereavement is working? Because during COVID, people couldn't have funerals, people couldn't grieve. What was that impact on families and children and things like that?
Yes, so during COVID-19, yes, there was periods of time where people weren't allowed to visit loved ones in the hospital. They weren't allowed to have funerals. They couldn't hug extended family members. All these things that we think would make us better able to kind of weather these crises. There's been some qualitative work on it. The challenge is it kind of lacks the counterfactual scenario, and so it's hard to really test, in my opinion, whether it's a qualitatively different experience. But that's where I think our new paper using the people who were widowed helps us to get a little bit of a handle on this, because in those data we have when we originally did it, because of the way they released the data as it was coming out, all we could look at were pre-COVID widows and people who were widowed during COVID and their loved one died of COVID. So that was the comparison group. But subsequently, they released people whose loved ones died during COVID, not of COVID. And so we have, under the exact same period, the ability to kind of triangulate that phenomenon. And what we find is that those whose loved ones died during COVID, not of COVID, look almost identical to those in the pre-COVID period. And it's really something about losing a loved one to this sudden kind of high health interventions disease that COVID was in the kind of early stage that is creating a worse circumstance, rather than just the lack of funerals or the social distancing or the general stress of the pandemic or any of those things, which I think sheds light on kind of a broader phenomenon in the bereavement literature, which I could wax a lot about. But it's, I think, a really unique ability to test what the mechanism is that's producing this kind of effect on people's kind of health from bereavement. The other thing that's notable about that is it's in 27 countries, so we find no differences between the countries in these effects either. And those countries had different levels of lockdown policies that you would expect maybe would give us a signal on that, but they don't seem to.
I have a really long way to go in this session. I was so excited about your presentation, especially how we're now in the space where our simulation can connect with the survey data and multiple methods there. I was really curious about your future work, your current work and future work in terms of modeling and incorporating the evolution of communication that's going on. This COVID is not, of course, one thing that is rapidly changing our world. And I think the communication modalities have major impacts for relational ties, without the relationship, for closeness, especially in families. And so I'll give you an example, which is my family's binational, 75% in Cuba, 25% here. When I was growing up, I didn't really have a connection to my Cuban family. I now have, I'm pretty sure, 100 text messages, mostly leaves. Most of my Cuban relatives, this is the morning ritual. And so my daughter, every day, has access to my national family, a really meaningful one. But the relationship's a little different because she has a wide reach. She has a greater number of family ties in an extended family, but those ties are not necessarily as strong. And that's due to that societal and that external illusion. So I'd love to hear kind of how you think future modeling can incorporate these massive shifts that impact structural structure and integrity of networks in a lot of ways.
Right, so the question is, how do these shifts, how could we think about the ways to include in these shifts kind of qualitative tie differences, not just the presence or absence of kin ties, but maybe the activities that those ties are engaged in, and how we might think about binational kind of communication networks as affected by COVID-19. And so there's kind of two answers that I'll give. One is that most of these models were historically only run in one country. Only recently have people thought of like, oh, I can actually treat it as like two different groups and then have people migrate between them and come up with binational kind of microsimulation models, which I have a project that we're trying to do that for Mexico and US. And thinking about that raises the problem of how do you think about bereavement for populations of immigrant individuals. So in our model, we didn't model Hispanic or Asian bereavement in the United States because they're populations with relatively high numbers of immigrants. And how do you deal with losing a loved one in India, which is not going to be an event that occurs in our model. And so we have some ways that we're trying to address that in subsequent work, but we haven't done it. Turning back to the first part of your question about how would you model changes in the quality or some sort of quality of tie component, not just the presence or absence of kin tie. You can simulate that upon these networks and think about engagement in, say, like communication networks and things like that. To some extent, that's going to be influenced by the number and volume of ties that people have. And so we could look at the demographic processes as maybe changing those number and volume of ties, and then we think how much change would you have to see in the qualitative nature of the ties to maybe overcome the broad scale demographic change or something like that. And so we have some models where we've done that with social support, economic exchange, and things like that. We haven't done it with talking to relatives in a communication framework, but the basic idea of modeling the qualitative components of the ties on top of the ties we're able to do. And once you fix sort of the number of ties as predicted by these microsimulations, you can begin to get a handle on how much change there would need to be to overcome some of the demographic underpinnings of these changes. The other thing that you could do with this, with Jim, we kind of did a model where we, which we never finished. I never finished because I went and got a job, and then I had to, do being a professor kind of things. But we did something with Ebola where we were thinking about kind of contact rates and the likelihood of transmission along these kin ties, and how it might be different, that you might contact your children every day, but your parents less often. And you might contact your siblings less often than others, and how those things might impact kind of transmission of disease dynamics, and how those kinship connectivity models might impact structural risk of a society for kind of disease outbreaks that in general our finding was that it's gone up tremendously in many of these places. Jim?
That makes your paperwork,
Yeah.
The disparity by race, the labels are really small. I'm just curious, given the events we've seen in the news lately, do you have gun violence and mass shootings as well?
Yes, I have a gun violence one, but it's like going under review in the next week or two, so I didn't want to spoil that one. This one is, I'm not as worried because it's too complicated, so.
Well, I hope it comes out.
Thank you.
Thank you.